Greetings, this is Dr. Eric Joseph. This is going to be a brief video presentation how to properly draw up a GLP-1 for injection, and specifically we're talking about semaglutide or tirzepatide, which we're now offering in our practice. I'm going to do a demonstration on myself with salt water, so let's make believe that the salt water is, or saline is the active ingredient, and this is one of the insulin syringes that are used. So the first item of business is you'll take off the top. In this case it's a plastic pop-off top. Your medication is going to come with a silver foiled top, and underneath that there'll be a white piece of paper on the rubber stopper over here. That gets completely removed. Next, you take an alcohol swab, and using one action, you just clean it like that. So this should be sterile. I'm putting the bottle of saline down, and I want to talk about the syringe. So the first thing to do with the syringe is to remove the piece of plastic that covers the plunger. So that comes off. And once that comes off, the needle is under here. You can see that the plunger can move up and down, and it's actually a little sticky to move at first, and that's pretty typical. So it's a good idea to just kind of move it around. The plunger is lubricated with a little silicone, and sometimes it's a little stiff from the factory. So now that this is moving freely, let's get on to how to get the medication into the syringe and then how to get it into your body. If we're starting with semaglutide, the starting dose is 0.25 milligrams, and because the product is 1 milligram per cc, you're going to want to draw up to 25 units. And 25 units is exactly 0.25 cc's. The entirety of this syringe, 100 units, is 1 cc. So if we're administering semaglutide, the dose is 0.25 cc's. And if we're doing tirzepatide, since the tirzepatide comes 12.5 milligrams per cc and the starting dose is 2.5 milligrams, tirzepatide, the initial draw would be 2.2. So let's say we're using semaglutide, and what do we do first? Your medication comes in a sterile container, as is this saline. So we can see where the air fluid level is, where the salt water ends, and where the air inside the container lives. If all of the action you were doing is sticking the syringe in and pulling out liquid, it'll eventually form a vacuum in here. So what I advise doing is, with semaglutide, since the first dose we're going to be drawing up 25 units into this syringe, is to fill the syringe with 25 units of air, as I've just done. Next item of business. Take off the orange cap. See the tiny 6 millimeter needle? It doesn't even hurt. You don't feel it at all when it goes in if you use good technique. So the first thing I recommend doing is, if you're right-handed, hold the needle in your right hand, hold the medication in your left hand. Then hold the needle like a pencil so you have control over the needle. And when you look at where the needle needs to go, you'll see there's a little circle that's outlined in the gray rubber stopper. So right in the center of the rubber stopper is where you want to push this in very carefully all the way down, boom, like that. It's in. We want to put the 0.25 cc's of air into the salt water bottle, so that this way we can now remove 0.25 cc's of semaglutide, or in this case, saline. The maneuver is, now you turn everything upside down like this, and you draw it up. So this is 0.3. So I'm just going to push up to 0.25, which is right there. And now we separate them. And that is how to get 0.25 milligrams of 0.25 cc's of semaglutide, or if you were using tirzepatide, you would do the same technique, except with 0.2 cc's. Injection technique. I rolled up my pants leg because you can really inject yourself anywhere. It just needs to be under the skin. So I don't really have a lot of fat on my legs, but as long as you can pinch some skin, it's a good place to do an injection. So we take our alcohol swab and we clean the area that we're going to inject. I'm right-handed. I'm taking my left hand. I'm going to inject myself with some salt water. I'm pinching the skin. I have to look at what I'm doing. So I'm going to hold the syringe like a dart, and pretty quickly, I didn't feel that go into the skin. So the tip of the needle is now into the skin, and now I move my thumb up here onto the plunger, put my index finger and middle finger onto the barrel of the syringe where it's supposed to be, and boom, you just push down, let go, pull out. It's as easy as that. The most common areas that people inject, if you're skittish about doing this, I'm going to put the orange. You're not supposed to recap needles, but for this demo, I'm going to put the cap back on. Another easy injection spot that doesn't require pinching or much else once it's filled is the thigh over here. Sometimes people are just afraid to stick themselves. So you hold it like a pencil and boom, you could just push it right into the area. The tip of the 6mm needle is not going to go into the muscle. It'll go just below the skin. There's a little bit more discomfort pushing it directly into the skin, and the needle goes a little bit deeper, so there's a little bit more of a chance of bruising as compared to lifting the skin up and pinching. Another common area to inject, abdominal fat. Pinch it, push it, and then you put your thumb on the plunger and you push the product in. I hope that this was helpful. If you have any questions about how much to use, how to do this, please give us a call at the office. Take care.